This is a special edition of Late Night Health. I'm Mark Allen. We're going to go to New York City. We're going to talk to Dr. Dana-Cohen. She's a respected physician, author of a book called Quench. We may even talk about water a little bit. She's an internist and integrative medical doctor. Welcome back to Late Night Health, Dr. Cohen.
Thank you so much for having me.
Always a pleasure. We've talked several times, and I know we have.
Yeah.
Let's talk about women, and this may be, I don't understand everything about women because I'm a guy. But there are health concerns that men need to be aware of because we love women. And if you don't love women, that's okay too. If you love women, it doesn't, but it's important for everybody to know these things. So let's talk about women over 40. What would be the number one issue that a woman over 40 needs to know about her health?
So it's, I think the number one thing is that your hormones are fluctuating during that time. And, much like when we go through puberty, there's these drastic changes in hormones. The same thing happens again for women as drastically above, 40 and in that perimenopause, menopausal stage. And it's a hard time. Like some women have a really hard time navigating it. And I think, you talk about the why men have to be involved, that I think it's important to raise awareness and to be able to have this conversation freely with your partners, with your male partners, with your female partners, whatever it may be. But I think it's just important to open this conversation because there are things that are happening to our bodies that can be mitigated by lifestyle and nutrition and certain other things, and you won't know until you talk to somebody about it or ask your doctor about it. But there are things that can be done.
There are a number of ads, radio ads and TV ads actually, that are running that talk about intimacy and pain, and that for lubricants for women, and in the past, we've talked about this, and some of them that are on the market can be harmful. Others are more natural. What's your take on that? Because that can be a problem as a woman enters and goes through menopause and postmenopause.
Yeah. So painful intercourse is absolutely a problem. I do prefer more natural lubricants. There's actually a brand new on the market that's made from hyaluronic acid, which is what women put on our skin to moisturize our skin. So then I have a vaginal suppository of hyaluronic acid that's FDA approved that I think is great. And there are treatments that women can do to help with vaginal dryness. There are lasers and radio frequency. I actually do that in my office. I use radio frequency, which is basically heat that can help improve painful intercourse. It can actually help improve urinary incontinence, which, like, women don't like to talk about urinary incontinence, but I'm here to tell you that you don't even have to have had a kid to suffer from urinary incontinence. It can just happen. And I think it's important to tell your doctor about it and to open this conversation, and also to help get these treatments over time may be covered by insurance. I think if women are vocal about it and realize that it's really a problem, more that we band together, more that we can maybe get some of these things covered by insurance, the way that, unfortunately, I hate to say this, but men's urinary incontinent treatments are covered by insurance, so yes, it's important to have that conversation and know that so many people suffer from it, and you don't have to have had a baby. You don't have to just go through menopause. It can happen anywhere starting in your 40s.
If you go to Costco, there is a whole aisle of feminine and male incontinence diapers and pads. It's got to be so embarrassing not to buy and to use them.
Yeah.
Right?
Yeah, I guess. Totally. That's why I'm saying to have this conversation to sort of normalize it, take away that embarrassment. It's like it happens to so many of us. It doesn't, it's not just, it's like a woman getting her period. We don't like to talk about it, but it happens to
It,
everybody.
well, it's,
So
it's like the 16, 17-year-old guy who goes to the pharmacy and needs to buy condoms or
I
wants to
know.
buy condoms. They're really embarrassed. We're talking about sex, and let's talk about HPV. There are, I guess there's a controversy about this. This HPV can cause, I didn't realize it causes several different kinds of cancer, predominantly cervical cancer.
Cervical cancer predominantly, but it can also cause vaginal cancer, anal cancer, throat cancer. Yeah, and it's those bad strains of HPV that that can do that. And we don't have any great way of testing for HPV. So contrary to what you think, when you go for a PAP, you're getting tested for HPV. It's more you're getting HPV in the cells that are maybe a little bit abnormal. And men have no way of getting tested for HPV. And it is probably the most, what's the word? The most, I can't think of the word, popular or
Common?
common virus that we transfer sexually. Like almost every single one of us will have been in contact with HPV, and more often than not, our bodies take care of HPV, our immune systems take care of it, but we're all being exposed to it. It's extraordinarily common, and right now, the only thing we have from our gynecologist, you go to your gynecologist, you get a pap smear, they're saying it's HPV positive. Let's watch and wait. There's nothing else to do. And I'm here to say that that's not true. There's a lot to do. And it has to, number one, always start with lifestyle, right? So stress, we know that stress kills. Stress ruins our immune system. So whatever we need to do to deal with stress, whether it's talk therapy, whether it's meditation, breath work, go getting a massage, it has to be talked about and dealt with. So that's number one. Talk about hydration. For me, the single most important thing you can do to treat and prevent chronic disease is learn how to hydrate with water or eating hydration fruits and vegetables, right? So that's the other thing. And then supplementation. I'm really excited about a specific supplement. It's a medicinal mushroom supplement called AHCC that has been tested on humans, and it's been shown to help clear HPV faster. So this watch and wait is not acceptable to me when there's things that we can do. AHCC.net is the website. You can look at those studies. But the other thing is also folic acid. We could take a little bit of folic acid. Most people who have cervical cancer from HPV are shown to have very low folate levels in their blood. So taking folic acid is also not a bad idea. So 2 supplement recommendations instead of that watch and wait: hydrate, exercise, lifestyle, eat well, and de-stress are some, watch and wait is not acceptable to me.
Should men also be taking that? Because there is a vaccine for HPV, and both men and women are getting that younger than I thought.
Yeah.
So that people my age, over 50, oh boy, it won't help us.
Yeah.
It's my understanding.
Well, I think the whole world should take AHCC. I really do think it's like when you look at those studies on AHCC.net, it's remarkable because it also helps prevent cold and flu. It also helps treat and prevent COVID-19. So I do think the whole world should be taking it, but it's not an inexpensive supplement. So the idea of maybe just willy-nilly taking it for a man when we have no way of testing specifically for HPV, I'm not sure that is something that I can just say off the bat. I don't know how long to take it. For women, what they've shown is 6 months of taking 3 grams a day, 1.5 grams of HCC twice a day is the treatment, is the course of treatment. I don't know how we would suggest a course for a man when we don't even know that they have HPV.
You have to wait, I guess, and that's not good. Let's talk about safe sex practices. I don't know if you're aware of this or not, but one of the biggest problems in retirement communities are STDs, sexually transmitted diseases. So the way this works is that Mr. Smith, who is either divorced or a widower, hooks up with Mrs. Jones, who is either divorced or a widow, and they hook up. Well, they get tired of each other. So they go to, I need another name, the Schwartz, the Schwartz, Mr. Schwartz gets involved with Mrs. Smith, and then Mr. Jones goes after Mrs. McGillicuddy. So, and it's all consensual, but it's
I love it.
rampant.
I love it. So first of all, what you're just what so first of all, what you're touching upon too is that sex doesn't end at menopause or andropause, right?
Right.
So
Yay.
yay, another reason to think about, vaginal health and that kind of thing. So I think that just goes for what we just started off the conversation with. But yes, STDs are a problem. And I think once again, having this open conversation, just because, you think somebody is, in their 50s, 60s, that they're no longer a risk. That is absolutely not the case. And getting tested, getting STD testing, using protection is absolutely still a conversation. And hopefully we're normalizing this conversation by just even discussing it here. No, everybody's at risk, and it's important to talk about.
I'm going to put you on the spot. After a certain age, insurance stops doing pap smears and mammograms or thermal imaging for breast cancer. And yet women over the age of 65 are more apt to get breast cancer and other cancers like this. And that's stupid. I'm sorry.
Yeah, I'd have to look at that because I'm thinking in my practice, I have had nobody. I mean, I've had a few women who's their gynecologist, and I have mostly women in my practice, just because I think women see the doctor more than men. I have a bunch of men, but mostly women, and most of them are in that menopausal range and above, well into their 70s, 80s, and I think that the pap smears, I've had a lot of them say, oh, my gynecologist says I don't really need to get pap smears anymore. And I'm like, still, I'll tell them to still go every 2 years and see. And I think if they just ask, they do them anyway. And I don't think it has I'm not convinced it has anything to do with insurance. I think, but I might be wrong. I might be totally wrong on that. So, and then the mammograms and that kind of thing. I don't think that there is a set number. That I think if your doctor works with you and you're vibrant and healthy, that your doctor just has to make a call and say, you know what, she's got another 30 years of living, you better do a mammogram on her. So, or whatever it is. I don't know of any insurance company that pays for thermal imaging,
I
by the
don't
way.
either.
Yeah, you mentioned that. I was like, oh, something I don't, because I would be excited about that. To do both, I think, is
And
really
it's more
optimal.
from the stories that I've covered over the years and talked to experts. It's actually more effective in discovering breast cancer earlier. It's not painful because you're with never having had a mammogram.
Yeah.
You're
We're talking about thermograms, right? So
yeah,
this is just so people are
right.
listening, we're talking about thermograms, which uses heat to detect abnormalities in the breast. And there's no pressing, there's no radiation. So there's a lot of reasons. Ideally, I have patients alternate every year, one or the other. And that's sort of an ideal scenario for me.
Right. And men can get breast cancer too. I have Richard Roundtree, I believe, who just passed away.
Richard Roundtree, the speaker?
No, the Shaft, the actor.
Oh,
I
oh my God,
believe.
you just scared me.
Oh,
Yes, I did. Is that his name, Richard Roundtree?
yeah.
Okay. All right. Richard
And
Roundtree is an
I
IFM
believe
professor.
he had breast cancer, and having
Mm,
worked with a number of breast organizations over the years, we've talked about the fact that men can get it. It's not usual, but
yeah.
it is something
Yeah.
that is possible.
So
Um,
just one quick thing though,
sure.
speaking about opening the conversation, it works both way for men and women, right? So men can also get osteoporosis, and they're never tested for bone density either. So I think it's important to have a doctor that. I think functional medicine is the where medicine is going to go, and it's growing and continue to grow, where we take a look at the whole person as a whole, and really look at preventative measures and all these things. So I think just opening this conversation, we opened up two things for men that I think are important to talk about as well, not just women.
Where do you think health is going? I mean, you mentioned functional medicine. You described yourself as not only an internist, because that's your degree, but you're as an integrative physician. So that, I mean, you're talking about AHCC, the mushroom supplementation.
Yeah.
So you're combining both new and old together.
Yeah.
That's
I think medicine is going back. I think it's going back to old-fashioned medicine, where doctors can speak to their patients, are allowed the time to speak to their patients, and really get to know their patients. And these 8-minute visits, seeing 35 patients a day is just ridiculous. Hopefully, and it's going to be more personalized. And I think we have to go backwards in everything, in nature, in our food, in our medicine. Unfortunately, I think tech and AI is not gonna cut it here.
got it. I don't know if do you remember the Donna Reed show?
I don't remember the show. I know of her, and I
Okay.
don't think I ever watched the show. Yeah.
All right. So the other night, my wife and I were looking for something with 87,000 channels to watch, right? So we decided to watch Donna Reed, whose husband, Carl Betts, who was a great actor, um, played a pediatrician. Okay. So he said to his nurse, he said, I need a follow up with Joey in a couple of days, make a house call appointment.
Mm.
I
Yeah.
remember house calls,
Yeah.
right?
Yeah. I remember it too. My doctor who lived on the corner of my block, Dr. Lipton. I remember when I had mono in the 3rd grade, he came to my house. I
Right.
totally remember that. Yeah.
Do you think
Yeah.
that'll happen again?
I do. I mean, I think it is happening in our field. Like, unfortunately, right now, it's only for wealthy people who can afford, this really personalized care, where we're,
The concierge medicine.
the concierge, and we're going to, their homes and doing IVs and stuff like that. But I think something's got to give. I mean, I don't know about the I think the Zoom calls is okay in that case, but I have to be honest with you, I don't love not being able to see patients. I always say my appointment starts when you walk in the door and I watch you walk into my room and sit down in front of me. Like, I gather a lot of information, whether I'm doing it, purposely or not. It's all built in there. I'm a trained observer. It's what I know to do,
Right.
and there's things that you can't pick up when you're doing a Zoom call with a patient, you know. Um, yeah. It's
Well, we
funny you
only have
talk
a
about the
couple.
TV. I'm
We
so
have
sorry.
we only have a couple minutes left. So if you're taking AHCC, you normally would take that with a glass of water. And you have written a book called Quench. We talked about this a couple of years ago. So I just have a couple of real quick questions. Do you think most tap water is bad?
I don't know. I think it's easy enough to look at your tap water from where you live. There's databases. Go to Environmental Working Group, ewg.org, and you can see what's in your tap water. No, I don't think most tap water is bad. I think most tap water is probably okay, but I do think it's important to check, or else we'll have another disaster like we did in Flint, Michigan, with the lead in the water supply.
Right. What's that website again?
EWG, environmentalworkinggroup.org, and you can search the database for what's in your tap water. I just want to say, if I were, another integrative doctor, they would probably say, yes, most tap water is bad, but you know, we all have to live in this world, and I think that most communities do the best with their best. That's good enough
But
for
if
your
you
tap
put,
water.
but if you put a goldfish in my tap water because there's a chlorine type chemical in there, the fish is going to die. So I'm
Have you
just,
tried that?
well, I know it will because as a kid, I kept tropical fish, and you
Yeah,
had to you had to put chemicals in the water to remove the chlorine or the chlorinamine or whatever it's called,
yeah,
all
yeah.
that stuff. So it
I mean,
bothers me.
it bothers me too. I will say I filter my water at home. I use a reverse osmosis filter. I do, but we also have to look at the big picture. And you know, the big picture is that most communities do the best that, you know, I don't know. I mean, this is getting into the weeds. It's actually sort of hard to say. Ideally, we want filtered water, right? That is
Right.
ideal. Or ideally we want spring water. We want real living water that you go collect from a spring and bring home with you. That's not realistic though.
And I had one of my favorite waters. I can't remember what the name was because I haven't seen it in the market lately. Was unpasteurized, and it was filtered through lava rock or something.
Yeah.
It was delicious. Last question: sparkling water are okay? Club soda?
Yeah. Yep. I totally I drink it. Pellegrino is my drink of choice. I love it. It's got nice minerals in it. And yeah, the bubbles are fine.
Got it. Just now I'm going to quote you to my wife, because that's all I drink.
Yeah,
The regular water, most of the time I don't. Listen, Dr. Cohen, thank you. Will you come back sometime?
absolutely. I will come back again. Thank you so much for having me.
My pleasure. And I'm hoping to get this up because I'm going to see Dr. Cohen in New York City as we celebrate the 20th anniversary of Pitch Publicity with Amy Summers.
Yeah, I'm looking forward to seeing you. We're going to have a good time. I'm dressing up too.
Yeah, I told her I was coming in shorts and flip-flops. Then I saw that the weather was going to be in the 40s. So probably I'll wear socks.
I love it.
Listen, doctor, thank you very much. By the way, if you want information, you can go to, I guess, ahcc.com.
No, ahcc.net. That's about the
.net.
supplement. And my website is drdana-cohen.com, drdana-cohen.com.
drdana-cohen.com. All right. That wraps up the special edition of the Late Night Health. Thank you, doctor. Thank you for tuning in, everybody. We'll see you next time. Bye-bye for now.